Opioids. Opioids are powerful pain-relieving drugs that bind to specific receptors in the brain, creating feelings of euphoria and deep relaxation. They include prescription painkillers like oxycodone, hydrocodone, and morphine, as well as illegal drugs like heroin and synthetic opioids such as fentanyl. Those who become dependent on opioids may develop a tolerance, requiring more of the drug to achieve the same effects, and suffer from severe withdrawal symptoms like pain, anxiety, and sweating. Long-term use poses serious risks, including overdose, respiratory depression, heart complications, and infections. Alcohol. Alcohol, a widely consumed depressant, affects the central nervous system, leading to relaxation, impaired judgment, and reduced coordination. Many Americans struggle with alcohol dependence, characterized by cravings, a need to drink more to feel the effects, and withdrawal symptoms such as tremors, sweating, and nausea. Heavy drinking increases the risk of liver damage, heart disease, various cancers, accidents, and violent behavior. Marijuana. Derived from the cannabis plant, marijuana contains THC, which produces euphoria, relaxation, and altered sensory perceptions. Regular users may find it difficult to cut back, experience irritability, anxiety, or insomnia, and develop a tolerance. While marijuana is often seen as less harmful, it still carries risks like cognitive impairment, respiratory problems, and a heightened chance of addiction to other substances. Stimulants. Drugs such as cocaine, methamphetamine, and amphetamines fall under the stimulant category. These substances boost alertness, energy, and reduce fatigue, but can also lead to addiction quickly. Users often show increased heart rates, higher blood pressure, insomnia, and signs of anxiety or paranoia. Prolonged use can cause severe health issues, including heart attacks, strokes, mental health problems, and a deep psychological and physical dependence. Depressants. Substances like benzodiazepines, for instance, Xanax, Valium, and barbiturates are known as depressants, which slow down the brain's activity, promoting relaxation and sedation. However, misuse can lead to dependence, as individuals develop a tolerance and experience anxiety, seizures, and tremors during withdrawal. The danger also extends to the risk of overdose, respiratory failure, accidents, and addiction to other drugs. Hallucinogens. Hallucinogens, such as LSD, psilocybin mushrooms, DMT, and peyote, can dramatically alter perception, mood, and thought processes, leading to hallucinations and delusions. While not all hallucinogens are physically addictive, frequent users may experience flashbacks, paranoia, and psychosis. Additionally, there is a heightened risk of accidental injury or mental health issues due to the disorienting effects. Inhalants. Common household items like gasoline, paint thinner, nitrous oxide, and butane are often misused as inhalants, which produce a quick, intense high. Inhalant use can lead to symptoms such as slurred speech, dizziness, and hallucinations. The dangers are significant, with risks including brain damage, heart failure, organ damage, and even sudden death. Prescription drugs. Prescription medications, including opioids, benzodiazepines, stimulants, and antidepressants, are often misused, leading to addiction and dependence. Those addicted may show tolerance, withdrawal symptoms, and impaired decision-making abilities. Misuse of these drugs can result in overdose, respiratory issues, mental health complications, and an increased likelihood of becoming addicted to other substances. Tobacco. Nicotine, found in tobacco products, is highly addictive and can lead to serious health problems. Individuals addicted to nicotine often experience cravings, irritability, anxiety, and difficulty concentrating. Long-term use significantly raises the risk of lung cancer, heart disease, stroke, emphysema, and other chronic illnesses. Synthetic cannabinoids. These lab-made drugs mimic the effects of marijuana, but are often far more potent and unpredictable. Users may experience symptoms similar to marijuana addiction, including increased tolerance and difficulty quitting. However, synthetic cannabinoids can be much more dangerous, with risks including heart attacks, strokes, seizures, and psychosis. Sedatives. Sedatives, often prescribed to treat anxiety and sleep disorders, include drugs like sleep medications such as Ambien, Lunest. Those who misuse sedatives may experience slowed breathing, dizziness, and memory issues. Dependence on these drugs can lead to withdrawal symptoms such as anxiety, seizures, and rebound insomnia. Long-term abuse increases the risk of overdose, respiratory depression, and cognitive decline. Anabolic steroids. Anabolic steroids are synthetic variations of the male sex hormone testosterone, often misused to enhance muscle growth and athletic performance. Users may experience aggression, mood swings, and hormonal imbalances. Prolonged steroid use can cause serious health complications like liver damage, heart disease, infertility, and psychiatric disorders such as depression and anxiety, particularly when usage is halted. Caffeine. While often overlooked, caffeine addiction is one of the most common forms of substance dependence in the U.S. Found in coffee, tea, energy drinks, and certain medications, caffeine stimulates the central nervous system, increasing alertness. However, excessive consumption can cause restlessness, anxiety, increased heart rate, and dependency, with withdrawal symptoms like headaches, fatigue, and irritability. Chronic overuse may lead to heart palpitations, digestive issues, and sleep disturbances. Club drugs. Club drugs like MDMA, ecstasy, GHB, and ketamine are often used recreationally in nightlife settings. They can cause euphoria, heightened sensory perception, and disorientation. However, these drugs pose significant risks, including dehydration, hyperthermia, memory loss, and even brain damage. Repeated use can lead to dependence, with users experiencing cravings, anxiety, and severe withdrawal symptoms. Over-the-counter medications. Certain over-the-counter medications, such as cough syrups containing dextromethorphan or antihistamines like diphenhydramine, are frequently abused for their psychoactive effects. Users may experience confusion, hallucinations, and impaired motor function. Continued abuse can result in heart problems, respiratory issues, and addiction. Withdrawal symptoms may include nausea, restlessness, and anxiety. Designer drugs. Designer drugs, such as bath salts and synthetic cathinones, are chemically engineered substances that mimic the effects of other illicit drugs. Often sold in misleading packaging, these substances can cause severe agitation, paranoia, hallucinations, and violent behavior. Due to their unpredictable chemical composition, users risk experiencing heart attacks, seizures, and psychosis. Long-term abuse can lead to significant psychological and neurological damage.